Oklahomans suffering chronic pain have long turned to opioids for relief. In fact, since new laws aimed at curbing the opioid crisis took effect, many who use the drugs without becoming addicted are finding those medications are difficult to access.
And that's because many primary care doctors no longer feel comfortable prescribing them. It is prompting some chronic pain sufferers, like Dawn Arbo, to seek an alternative to opiates.
Well, I was 16 at the time when I cracked the vertebrae in my neck.
Then a few years ago,
I was diagnosed with carpal tunnel in both wrists. It got to the point where I couldn't even squeeze my shampoo bottle in the morning.
to cope with the chronic pain from her conditions.
They put me on all kinds of medication that, you know, some of it worked, some of it didn't.
At times, those medications included opiates.
I don't want to live on that stuff every day.
Oklahoma's medical marijuana law offered Dawn an alternative way to treat her chronic pain.
So now, this is my regimen daily. Compared to all of this,
She uses a CBD tincture
there is no THC in it.
and a topical ointment.
If you can't use your hands, you can't make it in life.
Like many, she feared what would happen if her work knew how she treated her pain.
I was terrified because of the place where I worked.
So she left her old job to open a medical marijuana dispensary in Claremore. She says others, especially older people, want alternative chronic pain relief, but they're deeply concerned about potential problems at work, like failing a drug test.
And that is one of the majority of the problems that I'm hearing, is because they have to keep their jobs. You have to support your family.
Oklahoma's medical marijuana law does allow employers to take action against a medical marijuana license holder if that person uses or possesses marijuana at their place of employment.
Employers cannot take action against employees solely for having a medical marijuana license or if the results of their drug test are positive for marijuana or its components.